I apologize. So again, I would like to introduce you our retrospective study in a concentrate of peripheral blood progenitor cells, where we performed the DMSO removal before administration in our patients. Here you can see affiliations of my colleagues. It's a tissue bank and for Department of Internal Medicine of Hematology, Department of Clinical Immunology and Allergology, University Hospital, and we cooperate also with Faculty of Medicine of the Charles University in the Czech Republic. I can say that our study has only 13 patients, 9 men and 4 women, because we perform the DMSO removal only in the indicated cases. Here you can see diagnosis of our patient, which are in the most cases of primary amyloidosis or secondary amyloidosis as a complication at multiple myeloma. And those patients are treated by autologous transplantation by progenitor, peripheral progenitor stem cells. Here on this picture, you can see the algorithm of all the process. At first, progenitor cells are collected at a leukapheresis unit, and then collection bags, or one collection bag is transported into the processing facility, which is here in our tissue bank. And here the cryopreservation and storage takes place. We use normally the cryoprotective mix consisted of DMSO in concentration of 10%, 5% of hydroxyethyl starch, and also we add human serum albumin. And we mix collected cell suspension with cryoprotectant in the ratio 1:1. Then it is freezed in a programmable freezer, and then it is stored in a vapor in a container with a vapor phase of liquid nitrogen. As I said, in the indicated cases before administration, we test control samples, we TOF control samples, and we test white blood cell count, including differential lab tests. We test potency, and we seek CD34 positive cells. And what is important for us, it's sterility of our products. And then we perform DMSO removal using a high volume of hydroxyethyl starch and citrate, and using the centrifugation. And after DMSO volume reduction, we administrate these products into our patients. And here I would like to introduce you our methods, because our study has only 13 patients, which is not much. So we used median as a parameter, and we compared values at time of collection, after cryopreservation and thawing, and after the DMSO removal. And we wanted to compare all parameters from these 3 processes. For comparison of parameters, we used Wilcoxon signed rank test, And because of the multiple data comparison, we used Bonferroni correction of alpha significance level. You can see the value of it at the bottom. And here you can see first results. Those are results comparing data from leukapheresis and after cryopreservation and thawing. And you can see there is a significant decrease in total number of nucleated cells per kilogram of recipient's body weight, and also viability of nucleated cells and mononuclear cells, and of course their percentage. And you can see some significance in the dose of CD34 positive cells. And also there is a difference decrease in potency. You can see on the bottom the dose of CFU GM per kilogram. So those are first results. And on this slide, you can see results comparing the process, comparing data after cryopreservation and thawing, and values after DMSO removal. And you can see there is a difference in viability of mononuclear cells, and also some decrease in percentage of CD34 positive cells. And on the last slide, you can see all the process. It means data from leukapheresis and data after all the process, after the DMSO removal. And you can see red points. There is a difference in viability of nucleated cells. There is some decrease of mononuclear cells viability, and so on. We also were interested of recovery parameter. You can see the formula for recovery determination. And those are results on this picture. You can see there is a high recovery in the group of mononuclear cells at the first process, comparing data after cryopreservation and thawing. And at second, here are results after the DMSO removal. You can see high recoveries than 100% in nuclear cells, total number of nuclear cells and mononuclear cells. And also good values for potency for CF colony forming unit granulocyte macrophages. And on the last slide, you can see the recoveries after all process. So we can say that all the process is not so consistent and standardized as freezing thawing. So you can see lower recoveries of all parameters, I can say. And there is some conclusion of all three processes. So in the first process, comparing data from leukapheresis and after freezing thawing, there is a significant decrease of viability of nucleated cells, mononuclear cells, and those of CFU and of I can see all the slide, and of total number of nucleated cell per kilogram. And also there is significantly increased the percentage of mononuclear cells and also of cells which of progenitors. At the second process, DMSO removal, we can say there is a significantly decrease of viability of mononuclear cells and percentage of progenitors. What about total process? There is a decrease significantly of viability of nucleated cells and mononuclear cells and of all parameters. So the conclusion is that DMSO removal process led to decrease of several key parameters, and it should be performed only in the indicated cases, as I said, which are primary amyloidosis or some kidney failure and so on. You can see median and viability of nucleated cell, which was 78%, which is higher than the EBMT limit. So that's good result of it. And in our practice, typically 2 units are sufficient for achieving the EBMT or EDQM recommended limits. So you can see our doses for progenitors and for CFU GM per kilogram of body weight. We can say the DMSO removal process and total process recoveries revealed considerable individual variability. And as I said, it should be performed only in high-risk patients. And in our practice, we still regard the use of DMSO safe in the daily dose of 1 gram per kilo of body weight. And if there is some need of the higher amount for administration, so we administrate our products in several days regarding this recommendation. And here are the photos from our practice. On the bottom, you can see our tissue bank and some illustrative pictures from the processing in clean rooms. So thank you for your attention. And
thank you so much. It's actually really nice to see how exactly we can help with cells and with cryopreservation to real patients. So it's quite inspiring. And unfortunately, we don't have a lot of time to discuss these nice results, but we will find probably room for at least one question. So and you can see that we have a question from Alexander Petrenko. So
thank you very much for your interesting report. What is your opinion about reason in difference to DMSO removing of colony-formative cells and CD34 cells, positive cells? What is the reason you are thinking?
Can you repeat the question before CD4 positives and what?
And colony-formative cells. Cells which form
colony-forming units.
Yeah.
Maybe the DMSO process can destroy the cells, and in the case we have the sufficient dose of progenitors, it doesn't mean there is not a good potency of it. And we also interested in the correlation between CFU GM and between progenitors, and there is a high correlation. So it is corresponding. So the doses of CD34 positive cells corresponds with CFU progenitors.